Welcome to Connected by Health. I'm Dr. Krishna Madala. This is where medicine meets leadership, innovation, and humanity with one goal: to add value and help change healthcare for the better. If you believe health is about more than a diagnosis, you're in the right place. All right. Today, we're privileged to welcome a distinguished public health professor and advocate whose work has contributed meaningfully to both academic scholarship and applied public health practice. Through a career grounded in research, health promotion, and community engagement, our guest has advanced critical conversations around health equity, prevention, and the broader determinants of health. In this episode, we'll explore the contemporary challenges facing public health, including the translation of evidence into policy, the role of interdisciplinary collaboration, and the imperative to address some significant parameters of society that influence health outcomes. And with that, I want to introduce all of you to Dr. Kerry Morgan from the University of Central Oklahoma. Dr. Morgan, thank you so much for being here today with us.
Absolutely. I'm so glad to be here.
Can you tell us a little bit about yourself and what motivated you to go into public health?
Yes. So I am an educator and a health behavior researcher. At least that's how I see myself. And my work has always centered on helping people live healthier, more connected lives, whether that's promoting physical activity or supporting student wellness or helping organizations make impactful decisions. I originally gravitated toward public health because I love the idea of improving health at a population level, not just one person at a time, but entire communities. And I've always been fascinated by the way behavior, environment, relationships, those sort of peripheral things shape our health. And public health also focuses heavily on prevention, which is perhaps my biggest draw to it. So public health felt like the perfect place to bring all of those interests together.
Awesome. Yes. And even when I started my public health degree a couple years ago, for me, it was just the idea of looking at prevention, looking at what we could do to make communities and populations as a whole better. So it is a very vital aspect of society and often understated. And that's kind of leads me to my next question. How does investing in public health, like vaccination, sanitation, and disease surveillance, protect communities and reduce healthcare costs?
Yeah, investing in public health is really about strengthening the systems that keep our communities healthy in the first place. So we can focus on prevention like vaccinations, the surveillance systems, and sanitation. We can stop problems before they become crises. So these prevention efforts keep people from getting sick in the first place, which can mean fewer hospital bills, fewer missed work days, fewer long-term health complications, those types of things, not to mention, fewer deaths from preventable things. So I'm especially passionate about the disease surveillance side of things, or our surveillance systems and being able to track things and catch them early.
Yeah, no, definitely. And we have a whole episode dedicated in this podcast to looking at the fiscal impact of vaccination and how vaccination actually helps reduce healthcare costs. So, listeners, we have another episode coming specifically about the fiscal impact of vaccinations. But it is something that we really often don't think about. And it's almost as if vaccinations are kind of victims of their own success, where we don't see a whole lot of preventable illnesses today, such as what we do now with measles, polio, smallpox, and people don't understand how devastating those were. But switching gears, you're also very involved in addressing burnout. What practical steps can individuals and organizations take to prevent burnout and to support long-term well-being and productivity?
One of my favorite things, I've done a couple of workshops recently, and one of my favorite things to ask participants to do is make a list of things that both deplete you and things that energize you. And on that depleter list, go back and look at it and see, can anything be refined, right? Can it maybe be modified to make it more manageable? Can it altogether come off the list? Can you just revisit it? Does it even need to be there anymore? Or is it really imperative to your success? In which case, yes, of course, it needs to stay. And then really lean into the energizers. So what are those things that kind of give you a little bit of a boost and encourage you Because I won't say that public health is always easy, right? The work is incredibly rewarding, but also, it's hard work. And so I think it's just really important for anyone in public health, in healthcare, in helping professions to sometimes check in with themselves. So I think both at an individual and an organizational level, just offering those spaces to kind of step back and reevaluate. And I think I like doing the workshops almost because I do it with them, as I'm leading up to it. I kind of revisit what are my things that are maybe starting to deplete me a little bit, and are there things that I can do to resolve that? And I think another big thing is just communication. That's been really huge for me.
No, definitely. Burnout is something that I think we see quite a bit these days, especially during the pandemic and after the pandemic within the healthcare industry. On a systems level, what would you say would be a policy that could be modified or changed to help reduce burnout within the healthcare industry?
Such a great question. I think about a participant recently who shared that during COVID, one of the things that really helped them was to go into their office and shut the door and sometimes have the space to just be alone for a little bit. And I think for that person, at least, it was really well respected and has since carried over. And so it's been helpful to sometimes have your door open in your office, but also to be able to close it and that not be frowned upon by the organization. So I think, again, I go back to communication, because if you understand the why behind that, I think you can really appreciate that sometimes people need the space to step away from the hustle and bustle and then maybe come back to it. Now, of course, I know that's dependent upon the role that you have in that organization. Not always be feasible to shut your door if, let's say, you're at the front desk and your job is to welcome people in. But I think just really looking at our policies and revisiting whether they still make sense, because a lot has changed in recent years. And we also spend a lot of time in Zoom, and that wasn't even really a thing just a few years ago.
Yeah.
And so what does that look like? And having conversations and just deciding whether things still work that once did.
No, that's definitely true. Zoom, the utilization of Zoom and other telehealth services, even from a clinical perspective, telehealth visitation really just boomed right during the pandemic because of the need for it. And you're right. How would someone that has to be so at the forefront, such as a receptionist, be able to get even just 5 minutes of alone time in an enclosed space just to decompress? And it goes back to what you talked about, communication at the end of the day. And that's really, really significant when it comes to reform within the healthcare industry. You also have a great passion for health education. Can you tell us a little bit about how important health education is to tackling the obesity epidemic?
Yes, so I am very passionate about health education. That's really my roots. And to me, it's just about providing information and awareness and resources, whatever the case may be, to allow people to make an informed decision about their health. Some people were fortunate enough to grow up with health education in their schools, but in my experience, a lot of people did not have that. And so I think about a conversation I had with my dad where he had stopped drinking soda and switched over to sports drinks. And in that conversation, he was looking at the calories, but not necessarily looking at the number of servings. And it took 2 seconds for me to say, yes, and how many servings? My dad's incredibly great at math. So he was like, oh, so this bottle has, I want to say it was 200 and some calories in the bottle. And so it was just allowing him to make decisions. I think when I think about health education, I think a lot about health literacy and nutrition, especially because it is really challenging. And there's a lot of marketing that's intentional to sell us a product. And it doesn't necessarily allow us to always make the healthiest decisions if we don't have a little bit of added knowledge that's sprinkled into that that's more objective.
No, definitely. And I do think it's important. Health education is a very significant component of tackling the obesity epidemic and a significant component of obesity medicine in general, because medication and just tips on exercising alone are not sufficient to really address some of the issues that you see with obesity. It's a combined effort. And to all our listeners, at the end of the day, there is no miracle pill. I know that the GLP-1s have really been utilized over the past couple of years, but there's only so much that medications can do. And health education really plays a significant component of weight loss in general, but also in terms of weight maintenance, because the loss part is the easy part. Where everybody struggles is maintaining that weight loss. And that's where the health education really comes in. Speaking of that, in what ways does regular physical activity improve mental health and physical health? And how can communities make exercise more accessible for everyone?
Yes. So this is another one of my areas that I'm very passionate about because my roots are in exercise science, essentially. Physical activity, I think one of the things is, yes, it can support weight maintenance, and there are so many other benefits that people don't necessarily realize. So it can improve our muscle and bones, right? From strengthening and also maintaining bone mineral density, lowering the risk of chronic diseases like diabetes and heart disease. But also, if you have those conditions, it can help with managing it. From a mental health standpoint, it can help reduce symptoms of anxiety and depression, improve sleep, boosts mood, and just enhances overall quality of life. So it's just really one of those things that's incredibly effective and a proven tool that's got a lot of research behind it in the last several decades. So, yes.
No, definitely. Talked about a variety of different topics, specifically with health promotion, health education, also looking at the need to continue investing in public health for the sake of preventing preventable illnesses, but also for building a sound foundation for society. And one of the things that we also tend to forget about is research. GLP-1s didn't just show up overnight, right? It took years, decades of research and then eventually experimental trials, and then eventually came onto the market. But could you tell us how sustained investment in research helps drives breakthroughs that really translate into practical solutions, not just for public health, but for society in general?
Yes, so research is another area that I love. I think often I explain to my students that you can start off with an observation, right? You look around you and you have this observation, and that can be meaningful to prepare a hypothesis, but you still have to put that to the scientific test. And there are so many different ways that you can do it. I teach a class called epidemiology, and so we look at study designs like case control and cohort. If you've taken any research classes, you know that that's the gold standard, but it's not always realistic or feasible to begin with an experimental design, especially if we're looking at factors that could actually be harmful to health. So maybe we look around and we see something that could be harmful, or we hypothesize because we've seen it in our community. Well, we can put that to the scientific test without asking people to be exposed to those harms. We just learn whether they already are or not. And then we can see if there appears to be an association between that harmful factor and a health outcome or some sort of health event. So research is just really incredibly important to giving us some of those clues or determinants that allow us to better understand what leads to negative health outcomes or, negative community impacts. And then to your point, we can then further invest in solutions, and solutions is where we can put forth the experimental design or the randomized controlled trials that we talk about a lot when we are looking at the literature and see what works and really put it to the scientific test.
Many of the modern advancements in medicine or even in technology or just in general society, these things just didn't happen overnight. They took several years, in some cases decades, of constant experimenting. So it's not something that we will see immediate results. Research is something that we tend to see results several years down the road, but it's important that we continue investing. And so when you look at the research, the basis of it, and you kind of just expounded a little bit about randomized clinical trials. Why is rigorous scientific method and evidence-based inquiry essential for ensuring that innovations and new solutions are safe and effective before being implemented?
Yeah, well, I think you really hit the nail on the head with what you just said in that we have to put it to the test. We have to evaluate any risk factors or negative side effects, anything like that. And we have to see replication. It's not just one study that suggests that there's an association. We want to make sure that that stands up across multiple studies, especially in our disciplines of medicine and public health before we make broad recommendations. And yeah, that stuff just doesn't happen overnight. And even with my favorite study design, personally, cohort study design, it doesn't happen overnight if it's done prospectively across several years. And yet we get so much information from being able to follow people across time and look at a variety of different factors. And so it is incredibly important. And it does, part of that is it takes the funding and the time to be able to evaluate objectively whether there are associations between different things.
No, it's intense. It's time consuming, but it definitely is something that is worth investing in because you never know what you're going to discover and you never know what kind of an impact you're going to have until you continue investing and ensuring that these innovations and solutions are safe. So, we let's switch gears up a little bit again. I graduated with a master's in public health from the University of Oklahoma, but I grew up in Edmond, which is where you work. The University of Central Oklahoma is actually located, and I was really excited to hear about this, but I really didn't know until I think we connected on LinkedIn. Can you tell us a little bit about UCO's Masters of Public Health and Community Engagement? Because once I saw that, I was very excited that even in these times where there's great mistrust in science, in the rigorous scientific method, and in some ways even just great mistrust in medicine. For UCO to invest in putting this degree together really, really excites me. So, can you tell us a little bit about the Masters in Public Health program at UCO?
Yes, I would love to. So we do have our MPH program, which started in 2020, and we do have the focus on community engagement. What I really like about the program, and we have an undergraduate program as well, is that we have a lot of process classes. It focuses on how to go through the process, and you can take any area of interest, almost any area of interest that you have, and apply it to that process. So we have, for instance, qualitative methods, quantitative methods, of course, to give some research background, but then also things like healthcare policy and ethics, where students get to hear from a variety of different leaders and kind of just describing their approach to policy-driven efforts. We we have classes that are very much centered on processes. And so in that way, students can come in and whatever their interest is, the idea is that they will hopefully be able to take something, a topic that interests them, a population that interests them, and apply those processes or the strategies that they use in the classes. So we have things like leadership and management in public health policy and ethics, which is a really great class. My colleague teaches it and brings in a lot of community leaders and kind of gives their perspective on policy and the efforts that they have going, program planning and evaluation. And ultimately, it really is just very much centered on community engagement, hence our emphasis there and making sure that our students are in the community in some way. So a lot of the classes have some sort of partnership with a community partner or some deliverable that we're able to give back to a community partner. So there's a lot of intentionality in how we build the courses.
That's amazing because the thing that I am really excited about is you hit the nail in the coffin right there about community engagement, right? That's necessary. And I think you really have to have people in healthcare go out, talk, engage, develop that trust with the community if we really want to get policy in place and policy that is equitable, but also policy that is to a degree grounded in evidence and grounded in structure. And that's really important. And that's the thing that I'm really excited about. Just curiosity, how many years is the program?
Well, it's set up to be a 2-year program if you go full time, but we
Mhm.
also have the ability to structure it so that it can be part time. We have some students who do full time, and then others need to do it a little bit longer time span, especially if they are working full time and trying to do both. But our classes are set up in the evenings, starting at 4:30 to try to offset that a bit. And then we also have a hybrid model where some classes are in person and some classes are in an online asynchronous module, meaning that there's work to do, but you're doing it kind of on your own time that week. And so then the whole program is really designed to have that bit of flexibility. So it still has the rigor of that's expected of a Master of Public Health program. And we just finished our initial self-study our initial site visit after completing our self-study for initial accreditation. And so we're looking forward to a formal response from them this summer.
I think it'll be amazing, and I'm really excited, and it's necessary. And I really think more institutions really do need to invest more in public health education, but also offering young adults that are interested in getting into public health these kind of opportunities. So thank you so much for doing that, and thank you for University of Central Oklahoma for also putting that degree together. Uh, in conclusion, do you have any words of wisdom that you would like to give to our listeners, specifically those that are wanting to get into public health?
Yes, I do. So I would say that public health is an incredibly rewarding field if you're someone who cares about prevention, community well-being, and systems level change. So my biggest piece of advice is to stay curious and open-minded. Public health touches everything from policy, behavior, environment, equity. So the more you explore, the more you'll find of what really energizes you.
Well, that is amazing. Thank you so much. And to all of our listeners, I just wanted to let you all know April 6th through April 12th in 2026 is National Public Health Week. And public health is very important. A great number of advances that we have seen in human civilization today have all been attributed to public health, specifically when we're looking at vaccinations, when we're looking at sanitation, when we're looking at clean water. These all didn't happen overnight. They took many years, but the impact that they have made on our lives, I know it's often understated and often underemphasized, but imagine a world where we didn't have clean water. Imagine a world where people wouldn't make it past 30 due to polio or smallpox or unfortunately measles, which we're now seeing a rise and a return. That is a world that for us now is unimaginable, but that was the world that we're living in before the advent of public health. So please support public health. Once again, April 6th through April 12th of this year in 2026. And Dr. Morgan, thank you so much for your time today and answering all of our questions. We would love to have you back on the show down the road. There's so many more questions that we have. But once again, thank you so much.
Yes, absolutely.
If you found this conversation valuable, share it with someone who could use it. And if you're on Apple, we'd love to hear your favorite takeaway and a review. See you next week.